when patients have atrial fibrillation, some have it intermittently, or what we call paroxysmal atrial fibrillation, and some stay in it. So the treatment approach to atrial fibrillation depends upon how early the patient is in the stage of atrial fibrillation. Sometimes the doctor will choose to convert you out of it, back into a normal rhythm. And that can be done one of two ways. There are medications that can make that happen, or if the patient's resistant to the medications or their heart's going very fast and it's an urgent situation, we can sedate the patient, pass a small amount of electricity through the chest, which resets the mechanism, makes everything contract at once, then relax all at once, and sometimes you just go back into normal rhythm. If it recurs or those mechanisms don't work, the next treatment approach is medications that will be taken on an ongoing basis. And they can be medications that convert the heart to a normal rhythm, and they're designed to hold it in a normal rhythm, or medications that are just going to slow down the lower chambers because we can't get the upper chambers to convert back to normal rhythm. And we'll leave them quivering, but control the lower chambers so they're not going too fast. If the upper chambers are left quivering, the patient's in ongoing atrial fibrillation, they also need to be anticoagulated so that blood clots can't form in the upper chambers, break off, go downstream, and cause a stroke. The next level of treatment is when we go beyond medications. They're not working, we need to do something more. That level of treatment is based on what we call an ablation. And it takes advantage of the fact that electricity cannot jump a scar. So if the problem in AFib is that we have chaotic circuits of electricity going around, and that is the problem, we can break those circuits by strategically placing some scars. And we've learned how to do that, how to channel the electricity through the upper chambers so that every part of the chamber gets activated so it contracts, but the electricity can't keep going around. It has to originate from the origination spot, go through the whole area, and exit only one spot downstream, much like the maze in your Sunday paper. Enter here, exit here. And in fact, that operative procedure is called a maze.